Thank you very much. Good afternoon. First of all, I would like to thank Roger or the scientific committee for this kind invitation. I'm an internist, and I took care of patients, COVID patients, and I'm here to describe a particular kind of long COVID manifestation, which is autonomic dysfunction. That is what I'm studying for 30 years so far. Sorry if these are my conflicts of interest. Sorry, I try to be, I have to make a sort of introduction. And so autonomic nervous system, we can define as a sort of interface between the brain and the body. So every system, every organ is innervated in both motor and sensitive way by the sympathetic nervous system. The autonomic nervous system is consisting of two parts. One is the sympathetic nervous system that we could consider the throttle, the one that is responsible for excitation, the one that is responsible for the fight or flight response. From the other side, we had our brake, the parasympathetic, the vagal system, that is instead responsible of inhibition and also responsible for the restless digest. So, like every biological system, there is a balance between excitation, inhibition, rest, and activity, and the autonomic nervous system is responsible for these processes. Of course, the sympathetic is, we need sympathetic activity every time we do any kind of exercise, mental exercise, physical exercise. In this moment, your attention is driven by an increased sympathetic nervous system. So this is crucial. However, the problem is that if we lose the balance, so if we overuse the sympathetic and we don't activate the vagal ones, so there could be a problem. Would you mind to? This is just to show you how the sympathetic works and why this is so important. Okay, because without sympathetic, we could not survive. So sympathetic is the base of our survival, okay? Ancestrally is present since in any chordate animals. So all the story of this, all the study of autonomic nervous system, my study started on cardiovascular, in the cardiovascular field. In the clinic, the cardiologists were the first, and I have a cardiovascular medicine background, were the first to realize how important is the autonomic balance for the cardiovascular risk. And we can summarize, even in a simple way, that any therapy that chronically activates the sympathetic nervous system and or diminishes the parasympathetic modulation will increase the risk of cardiovascular events, while from the other side, therapies that tip the autonomic balance toward parasympathetic predominance and decrease sympathetic modulation will decrease the risk of cardiovascular event. Okay, so this works. This works in any cardiologist knows this. And it's so important that if we have to schematically represent the cardiovascular control, this is what we could schematize. So central integration is related to the balance between sympathetic and vagal that through afferent system control the cardiovascular system. But it's not only that. Until 20 years ago, we were thinking that the autonomic was only involved in motor and sensitive control of the organs. But now we know that this is only one part of what the autonomic is involved in. And one of the most important papers was published in 2002 by Kevin Tracy, who was the first to show and to demonstrate the so-called inflammatory reflex. So it was the first to demonstrate that the activation of parasympathetic afferent increase the parasympathetic efferent activity, reducing the release of inflammatory cytokines and improving this and increasing the release of anti-inflammatory cytokines. And many studies came out after this, and we schematize in this review that we published a couple of years ago, and we know very well now that sympathetic and parasympathetic activity have different and opposite action at the immune system level. So the sympathetic promotes inflammation and reduces the ability of immune system to respond to the threats, while the parasympathetic activity does the opposite. And this is very well, there is a bunch of paper that, of course, was out of the scope of this talk. But if you want to find out in this review, you can find all the literature. So now we could add another piece to what we saw before. So it's not only related, the sympathetic and parasympathetic related to motor and rest or activity, but also sympathetic is able to induce immunosuppression, while parasympathetic is able to induce immunostimulation, okay? So there is another part of this balance. And why this is important? This is important because because any kind of change in the body is reflected and detected by the autonomic nervous system, and any change that comes from the brain goes to the body through the autonomic nervous system. So this is a bidirectional. And I just would show you, this is a question that was posed in the last paper that I will show you right now, because we have always known that emotional state influences body physiology, okay? Anxiety, we know that if we become anxious, our heart rate becomes faster and the arterial pressure goes up. However, no one have ever proved that if the heart rate increase, then this can elicit anxiety. And this paper came out last year in March, and in my opinion, this is a paper that changed completely our perception of what is interoception, so the perception of the inner body. And so this is a very, very refined experiment made with in animal, freely moving animal with optogenetics. So this researcher were able to obtain, to induce with a viral vector to induce a specific protein in the heart that was able, when hit by a red light, to increase the heart rate. Okay, so these researchers increased the heart rate of a rat from 600 to 900, so mimicking an increased heart rate, and then they checked all the classical and paradigmatic response of anxiety. And with an increased heart rate, the mice showed all the behavioral pattern of anxiety. And when they did another part, they were able to stimulate through a blue light a part of the brain that is the posterior insula, that is correlated to the prefrontal cortex. They were able to shut down the tachycardia-induced anxiety. So, meaning that the brain is able to increase the heart rate, but an increased heart rate can induce anxiety. And why this is important? This is important because in many patients, let's say between 30–40% of the patients with long COVID syndrome has been reported an increased heart rate. And we know that there is a fatigue and brain fog, and all this could be some, the dots. Some of the dots could be related. So this is what, many years ago I published. So, you have to see the autonomy, you have to consider autonomic nervous system as an interface. If you have a viral infection, the viral infection activates, of course, an inflammatory response. That inflammatory response is detected by the autonomic, and there is a change in the activity that is, of course, taken by the brain first and then sent out again back. There are different and several ways to assess the autonomic nervous system in patients. I don't want to talk about the first three that we made in the past. We use heart rate variability. It's a very easy way, quite well methodologically defined. And, we can apply this to any, we need just an EKG, a digitalized EKG, 5 minutes. And then from the EKG, we obtain the tachogram, that is the time series of each RR interval. And then algorithms, in my case, autoregressive algorithms or fast Fourier transform, you can obtain heart rate variability. One of the problems of heart rate variability that now is commercially available even in the Apple Watch, in any app, and the problem is that too many times has been used without a methodological rigor. And of course, I review many papers that are just bullshit. And so this is the problem of heart rate variability. Because it's so easy, so easy to, but, the problem is that it's not, the interpretation must be not so easy. So going back to our clinic, so my message is when we lose, this is autonomic balance, and this is the yin and yang, and I'm sure that the autonomic balance, in my opinion, is the neurophysiological, Western neurophysiological description of the yin and yang. So when we lose the autonomic balance, we lose the immune balance. And of course, if we lose the immune balance, it's a mess. So going back to this that Roger had already seen, and I put it because, these autonomic symptoms have been reported, and mostly postural orthostatic tachycardia that I will talk to you about now. The autonomic dysfunction is really, really common. Autonomic dysfunction is very common in any post-viral infection, okay? Yesterday, not later than yesterday, we diagnosed a postural orthostatic tachycardia syndrome in an 18 years old girl who had Epstein-Barr virus infection 1 year before, and yet this fatigue and dyspnea and increased heart rate. So it's not specific for COVID. Autonomic dysfunction is not specific of COVID. It's very common as a sequelae of viral infection. And this is when we, if I had to define autonomic dysfunction, so far there is still a consensus between us, between the expert in this. And so this is what the Merriam-Webster dictionary said, that is a disorder of the autonomic nervous system that causes disturbances in all or some autonomic function and may result from the course of a disease, as diabetes, or from injury or poisoning. Of course, this is a quite limited, very old, so we should update this. But in any case, a disorder that causes disturbance in all or some autonomic function. All means that we can have an impact on any organs, okay? We may have neurological problems, pulmonary problems, cardiovascular problems, urinary problems, gastrointestinal, secretomotor problems. So all this constellation of signs and symptoms can be present or not. Sometimes there are only few of them, sometimes only one, but there is a constellation, of course, because the autonomic nervous system innervates all the body. This is the distribution of signs and symptoms that have been reported in the literature as a post-COVID. Okay, so tachycardia, so palpitation, dyspnea, fatigue has already been said as one of the most important. And so how it happens that we have autonomic dysfunction? Still, we don't know exactly what are the trigger and the molecular and the cellular pathways. What we know is that there is, of course, an interaction between the viral infection, inflammatory response, the activation of the inflammation directly on the heart, a direct activation as a neuroinflammation on the autonomic nervous system. And anyway, doesn't matter what is the initial trigger, at the end, the effect is that we have tachycardia in the majority of the case with other symptoms. And tachycardia, fatigue, and dyspnea are usually the three most important and most common, and I don't know whether also the family physician colleague who is here has this kind of, because I work with some family physicians and they send me this patient. I'm very common. Okay, then the name, the post-acute sequelae of COVID, etc. So what is POTS? Because this POTS I decided to specifically point out on POTS because this is something I will show you later in which now we can intervene. So post-orthostatic tachycardia has been described recently, 1993. The clinical autonomy neuroscience is a quite recent word, I would say, and is defined as an heart rate increase of more than 30 beats per minute within 10 minutes of standing or head-up tilt, okay? Usually, the increase is sometimes even immediate when the person stands up. Frequently is associated with symptom of orthostatic intolerance, so with a pressure that is between 190, very close to a presyncopal symptoms, and the symptoms must persist for at least 3 months. So this is quite challenging. Why? It's quite challenging because usually this is quite frequent in female, I would say 9 to 1, young female, and they are really, really disturbed. And this is a benign condition, but what is really affected is the quality of life of these persons. Usually they have some of them have the older ones, those with a socioeconomic status that is higher, they have a sense of no control of their life, and they develop a lot of anxiety. And there is a lot of problem at work, and it's a sort of vicious circle. So symptoms are really debilitating, palpitation, blurred vision, fatigue, brain fog. There is no clinical evidence-based intervention. We use ivabradine, we use beta blockers, but because we don't have any other tool to use so far. And this is a description that was gave by a patient. Imagine not being able to stand long enough to take a shower, or walk farther than 1 block due to orthostatic intolerance when you are in your teens, 20 or 30, while your peers are going off to college, getting a job, traveling, or starting a family. The simple task of daily living and rite of passage life experiences are either unattainable or accomplished with great difficulty and significant functional impairment. This was the testimony of a patient who had this problem. Okay? So it's really impacting, and so comes back to the importance of treating this patient, not only because post-orthostatic tachycardia of this syndrome are life-threatening symptoms or hide life-threatening conditions, but because they have an impact on the quality of life that is unbelievable. So, you know, POTS can be still POTS. We know that there is probably a constellation of reasons. There is POTS can be present even in some autoimmune disease, and there could be some autoimmunity can activate POTS. There could be some alteration of, and this is a genetic disease of the noradrenaline transporter. Mastocytosis is often associated with POTS. There could be a problem, a primary autonomic problem inducing POTS, or could be related to a central hyperadrenergic activation, so excess of sympathetic activity. So independently, what we should do when we have an orthostatic tachycardia is, of course, to see whether this is related to a cardiac problem, so inappropriate sinus tachycardia, or if it's a postural orthostatic tachycardia. So, for instance, this is the workup that is, of tachycardia that has been proposed by the American Heart Association for long COVID patients. So when we have a long-term post-COVID patient, an abnormal sinus tachycardia, so we have to collect history, physical examination, take the usual routine exam, and then we have to perform autonomic assessment, that is the heart rate and arterial pressure standing a lane, tilt testing, Valsalva and debriefing, to see whether they have a normal behavior, and to perform ECG and blood pressure monitoring. Of course, we have to rule out the fact that this tachycardia is related to cardiac problems or to pulmonary problems. But so this is it's quite easy, I would say. So if you have a patient who has an heart rate increase on standing more than 30 beats per minute, or a resting heart rate above 100, or an average heart rate on 24 hours above 90. So this is a tachycardia that you have to test whether it's a postural or not. And so these are now few studies that, all the studies I will show you now have methodological pitfalls, and they have been published using sample size very low. This study, for instance, provide in 13 long COVID patients, what they saw is that here, from that side, that there is in bold the number, this patient had an increased sympathetic activity and decreased parasympathetic activity, as we supposed at the beginning, okay? But, the sample size was 13. So really, basically nothing. So what we use in long term as a treatment: rehabilitation, pharmacotherapy, acupuncture. There are no evidence so far of treatment that is psychotherapy, that for sure works. And then there are other interventions that are coming out. And one of these interventions is to act directly on the autonomic nervous system and on the vagal nervous system. How? Using neurostimulation techniques. And this is, for instance, the transcutaneous auricular vagus nerve stimulation that we started using many years ago. And this is a non-invasive, no side effects stimulation in which the electrode is located at the level of a Simba conche. And the Simba conche contains 100% of afferent auricular afferent fibers of the vagus nerves that conveys the stimulation directly to the nucleus of the tractus solitarius in the brainstem. that is connected to the locus coeruleus, and so changing the balance between the sympathetic and parasympathetic, okay? So this is, and from one side do this, and from the other side, the increase in parasympathetic modulation reduce the heart rate and also reduce the pro-inflammatory response. So we have a double effect, an effect at the immune inflammatory level and one effect at the cardiac level. So this can be performed in non-hospital setting at home, does not require. We have a compliance that is very, very high. More than 280, more or less, patients so far. No one side effects. I know Angelica Carandina is my collaborator. She is the one that is in charge of this lab. And since there are all this connection, you can understand that if we increase the vagal activity, so we can make counteract. And now we show you, now this is not only vagal nerve, but now they are using, people are using direct current stimulation, transcranial direct current stimulation, or transcranial alternate current stimulation. There are ongoing studies. And this is a study using another kind of TVNS stimulation. Only if you see 12 patients, but in 12 patients they were used, they saw that there was a good response after only 2 weeks. Only 2 weeks of response. We have a very strong protocol. We stimulated the person, each person 4 hours per day while they do whatever. They just put the electrode and do whatever they want. 4 hours per day for 3 months. And we obtain. This is another paper in which they studied, they stimulate for 10 days, for 30 minutes only. So the problem is still we don't have homogeneity in terms of stimulation and but still they were able to see a change in cognition, so an improvement, and also a reduction in anxiety, a reduction in depression, and a reduction in fatigue. That these are all things that we see currently in all our patients. And this is one patient that I would like to just to show you. We published because this was a very striking results. This is an heart rate. This is a POTS. You see in the morning, this is an 18-year-old female with a history of incoercible vomit during 2-3 days, every 40-50 days. She was really bad, okay? And she quitted going to school. And so we noticed this with an Holter recording that in the morning, when she wake up, you see, from 70, the heart rate went to 150 and stayed high during the whole day. So we decided to, and this is the, 7 days like this, we recorded. And there in the red, she had the cyclic vomiting. So we put, for 8 months TVNS, and the heart rate decreased significantly. We removed after 8 months, and after now is 1 year, more or less, that she does not do anything, and she recovered completely. So at the end, so between 10 and 15% of COVID patients develop long COVID. We saw the autonomic dysfunction can be associated with signs and symptoms that are systemic or local. Tilt test and prolonged Holter monitoring and 24-hour blood pressure are useful in the diagnosis. Non-pharmacological measure and heart rate regulating blood pressure stabilizing drug are the cornerstone of the therapy that is no evidence-based anyway. And transauricular vagal nerve stimulation therapy is waiting. Thank you very much.